sincere.
Yep.
And the stuff was super intriguing. And so been following you for a long time and told Jimmy about that. Jimmy and I are both athletes. We've lifelong athletes. We were wrestlers. I run ultra marathons still. So your work is super fascinating. And then also, as we've gotten older, friends in the military, family members, stuff like that, TBI has been something that's come onto our radar, and we've had experience in some way, shape, or form, either with family members or friends that were either in military or accidents. I also know of a snowboarder who had a pretty serious accident in Vail, and he has a foundation and everything. So it's an honor and a pleasure to have you with us this afternoon, evening. And we want to get into everything that you've got going on. So I guess to start off, why don't you let the fans know where they could find you, all your stuff, and all that sort of information, and then we'll get into the film and all that stuff with you.
Well, first off, Richie and Jimmy, it's really a pleasure to be here. I like expanding my horizons by interacting with people who are on the ground, who understand what it is that, we're working with. And for those people who are listening, who are interested in finding out more information about what it is I do in the area of traumatic brain injury, neuropsychiatric illnesses, can go to the educational site, which is www.tbihelpnow.org. And then under the section, the science, you can see a lot of the articles that we've published relative to our patient population. I take care of strictly military. My daughter, Allison, Dr. Allie Gordon, takes care of the civilian population, professional sports, and civilians with significant head traumas or with head traumas. Um, our product line, which I'm self-funding, I use products that we developed that we've tested for up to 16 years in our patient population to fund our projects with our veterans so that we can carry a lot of the burden of the financing while they're getting through their program and getting better. And those products are at millenniumhealthstore.com. Millennium spelt with double L and double N. A lot of people miss the second N. So that's where you can find us on the site. And there's a lot of education. I'm an educator and therefore want to share as much as I can with those people listening relative to how you can biohack yourself and understand a little bit more about sequela, things that happen after you have a trauma, whether or not it's from um, competitive sports or with impact sports like football, obviously, MMA, and so forth and so on, which we have a number of people that we interact with from the professional arena, BJJ, mixed martial arts, taekwondo, Muay Thai. When I just came back from Thailand, a lot of Muay Thai people, and now picking up people from Australia who go to Thailand to practice their Muay Thai and then end up with percussions of it or repercussions of it. So that's basically.
Awesome, thank you.
You're
And
welcome.
so, I guess for maybe people who have been living under a rock for the last couple of decades, can you maybe give just a brief rundown of what quantifies or what constitutes a TBI?
Absolutely. Uh, TBI, unfortunately, is a label that has a lot of misconceptions and mythology associated with it. The number one that I deal with, especially with the military, is the fact that you have to have either loss of consciousness, like concussion, loss of consciousness, to have the process of traumatic brain injury, mild TBI, moderate TBI, which is associated with changes in mental functioning. So a traumatic brain injury is usually a physical force applied to the brain, to the skull, that transmits to the brain, and in transmission to the brain, for me, sets off chemical processes that are harmful to the function of the brain. And that is what, over a period of time, leads to personality changes, behavioral problems. You're aggressive, you're angry, you're depressed, you're bipolar, you're schizophrenic. You have cognitive impairment, meaning that things that were easy for you, reading, writing, um, following a trend or a train of thought patterns, these things all get jumbled up in the brain. Because in order for you to interpret what's going on around you in sight and sound and touch, you need to have a brain that is able to interpret it. And think of it as electrical circuits, where when you have traumatic brain injury, those electrical circuits are impaired, and at extreme conditions, they can be severed. So you lose communication between different areas of the brain. We've had veterans who have been exposed to multiple IEDs or blasts in general, who have lost the ability to look at a page with words on it and to read the words, or they're able to say that's a WORD, and you ask them, what does that spell? And they said, I don't know. But they just got finished telling you the letters of the word. But this is disconnect between areas of the brain due to the most important factor that causes traumatic brain injury, and that is inflammation. All those hits that you get turn on chemical processes that lead to inflammation in the brain. Think of it as a fire that starts in your living room. If you put it out, you're cool. You put in a new couch, change the couch you didn't like. But what happens if you don't catch it early enough? The fire spreads from the living room to the den to the bedrooms to upstairs and destroys the entire house. That's the analogy of what happens to the brain if TBIs are missed. Project that I have next month is in Tampa, dealing with subconcussive traumas. These are hits that the brain gets that doesn't cause any acute or immediate symptoms or effects. But over the course of time of constantly getting these subconcussive micro traumas, what happens is it accumulates and creates the exact same thing as being knocked unconscious. And we're now starting to appreciate that. We recognize that in our veterans who were exposed to multiple blasts, micro blasts, or charges, small charges, are far enough away from a series of blasts where they didn't get the full blast wave, or someone who is shooting a 50 caliber machine gun, or the person who is on water skis going over those moguls, or skiing over snow and going over those moguls, or someone who is a pneumatic drill, using a pneumatic hammer or a drill cutting up concrete. Those impact traumas are subconcussive, but over time will create problems like neuropsychiatric, psychiatric conditions. So that's what encompasses in a traumatic brain injury. And it's a label that I find misdirects a lot of people. Oh, he had a mild TBI. So you only look at him as a mild TBI and totally ignore everything else, if you understand what I'm saying.
Yeah.
So we have to look at that. And a lot of our patient population, military that I see, come to us with psychiatric conditions. It's not the fact that they wanted to develop depression. It's because the change in the chemistry of the brain that's avoiding depression is broken. The option is not depressed or depressed. Wash on, wipe off. Okay, it's either one or the other.
Okay. And so before we get too deep into this and talking about the movie, I just have a personal question. When I was 11, I had a grand mal seizure.
Okay.
And you're talking about like wires getting crisscrossed and things and things in the brain. Have can things like epilepsy have sort of similar on the back end, similar symptoms or things like TB?
Absolutely. We have a subpopulation of our veterans who are exposed to moderate to severe blast wave trauma. Not a single cut on their body, just the impact of the blast wave was enough to create a problem. And the problem was seizure disorder, epilepsy. And if you look back, that epilepsy is due to neurons being dysregulating their electrical discharge. So instead of being a nice smooth pattern of electrical discharge, you get this aberrancy, this abnormal firing. And if you look at them, if you look on Google Scholar, you look up on the any of the academic websites for medical literature, you can see inflammation and seizure disorder. You can see head trauma and seizure disorder. So they say, okay, head trauma can cause seizure disorder, but the underlying mechanism that the head trauma leads to the seizure is the neuroinflammation that dysregulates, disrupts the natural process of electrical conduction and discharge in the brain. Instead of having it sequential, you get a blast. And that's what puts people into grand mal or petit mal or one of the forms of epilepsy. And we've had people who followed their EEGs where they're on treatment with one of our products that helps to reduce inflammation. And you see that they improve. Another is people who develop migraines. Migraine is an inflammatory process. And what happens is it's the way the brain responds to the amount of inflammation. We have people that are totally their migraines have been mitigated, removed. We have a veteran here in town who Thomas, who was getting 2 to 3 migraines a day for 3 to 4 days a week. So he couldn't function. He was cloistered in his apartment with eye bands on, with earplugs on, with the shades dropped, in bed, on pain medication. 9 months addressing the neuroinflammation, his migraines are gone, totally gone. And this is what we see in different degrees and frequencies of people with migraine history. So your issue about seizure disorder is an inflammatory process.
Okay. Yeah, because like I was saying, when I heard you on mic the first time, a lot of the things that you were talking about really started to resonate. And you talked to
Mm-hmm.
family members and things, and you even looking at photos from before the seizure to after the seizure in terms of like my, hamming it up or smiling and those sorts of things. Kind of, it's a different, they say, oh, your personality changed. There's a lot of differences. And then just some of the symptoms that some of the TBI people experience are, things that I've gone through or things that I deal with. And I'm just curious if some of your products and some of those treatments
Right. Yeah,
could.
we do have a protocol that we had the Marines out of Camp Pendleton in California help us with. I went and lectured for them, and then the commanding officer and the surgeon liked what I had delivered to them, the information, and they ended up sending me a group of Marines that were in the process of getting medically discharged, and we put them onto a protocol that was very, very simple, one product. And we monitored them for 90 days with 18 questions every 30 days. And 65% of them were 50 to 100% better after 90 days. 35% of them did not attain at least a 50% or greater improvement. And that became my focus. And it turns out how important lifestyle choices are. What created the problem in those 35? Alcohol consumption, drugs and alcohol, not sleeping, not eating well, poor nutrition. They don't have the good things, not hydrating well, not having good sleep hygiene, and not meditating or learning how to relax. I try to meditate at least 15 minutes 3 times a week. Whether or not that's laying down in my bed or sitting there in a chair with my eyes closed just to shut everything off and recover, because they found that it drops cortisol, the stress hormone. And cortisol is not, a very a friend of ours, especially with traumatic brain injury. Going back, Rich, the question is, at 11, you started seizure. I would look at your history from birth to your 11, because what we miss are some simple questions. What type of birth did you have? What,
Natural.
what's
Would
that?
It was natural.
It was a
Could you tell
natural
them about the
vaginal.
medicine, Rich?
Yeah, so I guess before we get into the history, I
Yeah.
was I was in I was sick all the time in elementary school, bronchitis, upper respiratory infections constantly,
Uh-huh.
a lot of allergies. was going to Children's Hospital to get allergy tests and all this stuff. And so it was always, well, let's try this allergy medicine or let's try that allergy medicine. And nowadays, every pharmaceutical commercial you see on TV, at the end it says side effects or symptoms may be, and sometimes it's seizures. Well, I was on one of these medicines. It was a new, I couldn't tell you what it was, but
Right.
they at the time they pinpointed that that was probably what caused the seizure. And then I
Also, let
graduated.
them know why you had the asthma.
I'm going to.
All right, sorry.
Yeah. So I graduate from fifth grade, go to the new school at the middle school, and almost instantly with being in that school, my health cleared up. I had no respiratory infections, no allergies, no nothing. And
Hmm.
then that year that I left that school to go to the new school, the old school was condemned for black mold.
There you go. Yep. You are allergic to nigrins. Yeah. Aspergillus nigrins. Nasty stuff.
Yeah.
But if that wasn't a component of it, even things that we forget in our childhood, like learning to walk and falling against the wall, you're holding your hand against the wall as a 10-month-old, 11th, and you slip and fall and you hit your head. Or else learning how to roller skate, skateboard. Did you skateboard as a kid?
A little bit, not nothing like crazy.
Nothing big, yeah. Bicycle, skateboard, screwing around, hurting yourself, slip and slide, jumping into a pool, hitting your head. All these things we totally negate. And they're the earliest traumas to our brain that predisposes us. Those are the subconcussive that accumulate over time. Now, we have research that shows that markers for trauma in the brain called cytokines, which are produced by our immune system, that you can have cytokines, specifically interleukin 6 and tumor necrosis factor alpha, persistent for up to 17 plus years. So it tells us that the inflammation from the initial injury to that 17 plus years is ongoing. And it's this chronic exposure of our sensitive brain tissue to these inflammatory chemicals that lead to it losing volume. I have a slide in one of my presentations where it shows the rate at which the brain shrinks in normal aging, just a little bit, and then how rapidly it shrinks after a traumatic brain injury, because the cells are attacked by like acid. So if you think of inflammation like acid, it leaches away layer after layer of brain tissue, and that's where the brain gets smaller and smaller in what they call atrophy. And there's lots of science out there, and MRIs and CT scans and all those posh-looking exams to show you the difference. But looking at history is very important. One of the groups of patients that my daughter Allison Gordon sees, she takes care of all our civilians and professional sports people, is that they totally were negated on their history. No one asked them about car accidents or slip and falls when they were young, or the sports they played in high school, because they think now 20 years later that it doesn't influence them. That's not true. The study that shows that chemistry lasts for such a long time means you have to delve into their history. Commonly what we see is a guy comes into us and he says, I want to be evaluated. And why? Because he went to his primary care doctor with complaints of loss of libido, depression, a little isolation, a little weight gain, not sleeping well, irritability, agitation. And immediately they wanted to put him on a medication. Okay. And no one stops to ask, have you ever had any head traumas, or have you ever played any sports or had any of these kind of situations occur? I hate saying, have you ever had, any brain trauma? Because the interpretation, translation of what that means is so different from person to person, because those labels have misperceptions in them. So I try to say, have you ever had fallen off your bicycle or this or that? And we've had some people from Lance Armstrong's group way back in the 90s, early 2000s that we saw that, had crashes, and they're wondering why they've developed depression. We go through their hormone assessment and you see key hormone deficiencies, pregnenolone, progesterone, testosterone, growth hormone deficiencies. And when you replenish it, they get better. Even my own story. How did I get into this field? In 1990s, I developed depression. I was in my early 40s, developed depression, and ended up getting on an antidepressant. And how I escape in my world is I read. And I read about the relationship between trauma and the loss of hormones. And then there's a few articles at that time, hormone deficiency and mood changes. And I went and got my blood drawn. And I was found to have growth hormone, thyroid, and testosterone deficiency. Within 90 days of getting on to hormone replenishment, my whole world came back to me. Better, absolutely better. And that's what started me in this deep dive. And then it wasn't until 2002, I moved my offices from a workman's comp family practice into high-tech hormonal replacement, hormone assessment and replacement. And at that time, in 2002, I went back to my patient population and started doing relationships, not with the people, but relationships with their lab and trauma. And I'd call them up. Guy came to me, 21 years of age with depression. Have you ever had any trauma? Yeah, I was in a motorcycle accident. Click, check that off. Did you have it? Yeah, at 18, 43-year-old with depression. He was in a T-bone accident and his head whipped to the side, left side, hit the side window and didn't lose consciousness, but he got a nice whack on that. And that created the impetus, the beginning of the process of inflammation that led to years down the road developing depression. And we now know definitively how the process of inflammation removes two very important hormones from the brain, serotonin and melatonin. Without serotonin, depression. Without melatonin, you can't sleep. And when we look at our patient population, they all come with three very simple or consistent findings: insomnia, depression, and fatigue. Insomnia, depression, and fatigue. That's it. And you go into their history and you find their trauma they had, their hit that they had. Still trying to find the right word because I want to get away from trauma, because people say, oh, I wasn't traumatized, or I didn't have trauma. And we now found that even under 100% stress, this thing that they call PTSD, it really, really rarely exists in isolation, meaning only stress, because everybody's had some form of trauma or injury or hit. And so with this thing called PTSD, for me, it's a missed opportunity to have treated a TBI, because as you go through time and fail to treat the original injury or event, trauma, TBI, whatever you want to call it, it burns other areas of the house, of the brain. And that leads to the symptoms that we ascribe to PTSD. And in a study that we did March of last year, we randomly had a group of veterans that we, in our entire population, sent out an invitation. Randomly, people came to us, and we then looked at them from TBI and PTSD as diagnosed by the Veterans Administration. So there was a group that had nothing but traumatic brain injury as their diagnosis, and then another group that had a post-traumatic stress disorder, PTSD diagnosis. Looking at their medical records, it turns out they all document that they had traumatic brain injury, but the VA only put it down as a post-traumatic stress disorder, PTSD. And for us, we don't separate them into groups. We take everybody being the same, run them through the same 28-point biomarker panel that took me about 14 years to develop. It's now interpreted by a high-tech artificial intelligence software application, because the depth of information that it looks at, one person, two people, three people cannot keep in the front lobe of their brain, keep readily available. So we ended up building a software package. So it finds the hormonal deficiencies from the trauma. And what we do is we replenish the hormones while we address the inflammation. What happens, their PTSD improved by 71%. They eliminated it. And in the TBI cases, 77%. So 70% and greater resolution in 1 year of people with psychiatric problems relative to TBI and psychiatric problems relative to PTSD, which tells us what? Using the same treatment, they've got to be the same problem, but they're given different names, and therefore they're isolated based upon the label, not based upon the biochemical disruption that we find. And that's what we find. Hormonal deficiencies and higher levels of inflammation in their brain. And when we treat it, that's what happens. At the website, tbihelpnow.org, under the science, almost every year I've put together an article that looks at our population of veterans and civilians and their outcome. What is that based upon? Every one of our patients fills out what's called a monthly program questionnaire. It's 25 questions, and they just score themselves. So theoretically, if they start at time 0, their scores are 0. And as they go through our program, their scores should improve, showing the relative improvement over these 25 different areas that we're questioning. Psychology, psychiatric questions, physiologic questions, and physical functioning. And you see a lot of them start going to the gym, they start having great workouts, their libidos come back, their cognition is better, their sleep, which is primary. For everything to improve, you need to sleep very well. And in almost 100% of those who are not sleeping, what we find are a deficiency of something called pregnenolone. Pregnenolone is extremely important in the brain because what it turns into: pregnenolone, progesterone, allopregnanolone. Allopregnanolone is a pharmaceutical product that's $34,000 a year. Pregnenolone is $80 a year, and does the same, ends up generating the same chemistry. So we have people who can't sleep. And one of the cases was a Marine who came to us. And one of the questions I asked about sleep is, so how long are you in bed? He said 13 hours. And I'm looking at his results of his pregnenolone progesterone. He doesn't see it. And I said, oh, after 13 hours, you must wake up feeling really good. He says, no, on the contrary, I wake up feeling like I never put my head to the pillow. And I said, really? And then I explained to him that his pregnenolone was non-existent. And pregnenolone, progesterone, and allopregnanolone stimulate the brain to make GABA. GABA-aminobutyric acid, is the natural Valium of the brain that allows you to get into sleep and to go into deep sleep, go into sleep. So without pregnenolone, you can't sleep. I just came back from travels to Southeast Asia. When I came back, I was, jet lagged. What did I do? I didn't take melatonin the first night. I took pregnenolone, 100 milligrams, about an hour, hour and a half before bed. I slept like a baby throughout the night. To embellish it, I added 1 milligram of melatonin. It's additive, synergistically and additive to pregnenolone. And I was groggy waking up the next morning, but I slept solidly for 8 hours. And I don't sleep 8 hours ever. I sleep, 5 to 6 hours if I'm lucky. But I wake up with plenty of energy, because for my body, what I've been doing for 30 years to maximize my hormones, minimize my inflammation, is to, make sure that the chemistry of the brain is optimized. Long story, but
Thank you.
That's it. Sorry.
No, that's what we were looking for.
So you brought up at the beginning, you brought up the inflammation to the brain. And is there anyone who ever comes to you who might have had some of these traumatic experiences, traumatic injuries, and because of their lifestyle, they've been able to negate the inflammation? Or is there always going to have to be some kind of need some testosterone? You've mentioned some other or other hormones. Is there going to have to be some hormone replacement therapy at some point?
It's a great question, Jimmy. What we found is called biological resiliency. What that means is the body's ability to fix itself. And we hook into that network, that system. And so, in terms of what they can do, we know things like fish oil, omega 3s. Dr. Michael Lewis, Colonel Michael Lewis, retired, wrote a book called When Brains Collide, talking about fish oil and how they can drop inflammation in the brain. So fish oil is in every one of our products, the Brain Rescue, Brain Care 2, Brain Rescue 1, Brain Rescue 3. They've got fish oil in it, but a unique component of fish oil called DHA. There's EPA and DHA. DHA is very unique in the fact that it turns on a lot of protective chemistry of the brain and drops inflammation in the brain. Quercetin. Quercetin, very good, 500 milligrams twice a day. What it does is it drops a triggering mechanism, what we call a transcriptional signal that goes into our DNA and turns on inflammatory chemistry. That's what quercetin does. It's called NF-kappa B. It helps to downregulate that. The tocopherols, the vitamin E's. There's alpha, delta, and gamma. Gamma tocopherol is extremely good for dropping inflammation. N-acetylcysteine, another one that the federal government did some major studies on. So to answer your question, yes, there's a lot of things that we can do. Eliminating inflammatory nutrition, so low inflammatory nutrition. Staying away from alcohol. Very important. Alcohol is a nemesis for us. And then there are certain medications that will change the chemistry in the brain. Things that affect GABA production, things that suppress luteinizing hormone that generates our steroidogenesis, like narcotics will do that. It also influences thyroid hormone, also influences growth hormone. So there are things that we can do. You can also take in good protein, red meat, and get growth hormone turned on because certain amino acids, lysine, arginine, alpha-ketoglutarate, these are things that can turn on the production of growth hormone. So yes, and in a study that came out, just to backtrack a little bit, a study that came out in 2013 talking about inflammation shutting off the production of testosterone. And it's a fascinating area. And what they found is that there are cells in our brain called astrocytes that produce a chemical called PGE2 that helps the area of the brain called hypothalamus release the signal to tell the pituitary to release luteinizing hormone, so that can go to the thecal glands of females to generate hormones, or to the Leydig cells of a male to generate hormones, testosterone, and so forth. So they found inflammation shuts that mechanism off. And that's the majority of the vets that we see in our private civilian population who have had trauma. They've got inflammation that has shut down their testosterone production. So what do? We shut off the inflammation. And our products are 100% nutraceuticals. They all come from, natural stuff on the box, or they can go to the TBIHelpNow.org under the science, and they can pick up it's the Brain Rescue 3 data sheet. It has all of the products and their composition and what each one of the components does. As I said, I'm an educator. I want people to know exactly what they're buying, what the benefits are, and there are tens of thousands of articles on each one of the components to support what they do, how they do it. So yes, biological resiliency, you can build that up. Exercising will increase brain-derived neurotrophic factor, which is a key element to help with regeneration of brain tissue. There's also peptides out there that you can inject that will increase the production of brain-derived neurotrophic factor. I'm working with a popular back in the 90s. He was famous at that time, um, boxer, middleweight boxer, who got into a bad fight and he lost his title, but he had a stroke after the insult. And 29 years later, his sister, Lisa, comes to us and we assess her brother and we start him on appropriate treatment based upon the laboratory results. And we added one of the peptides that increases brain-derived neurotrophic factor in 3 months. After 29 years, in 3 months, according to everybody else, not me, he's about 20% better. His pastor, sister, therapist, everybody, and they enumerated where he's improved from the past. And so we have technology that can absolutely help with recuperating brain function. And you can do it through activities, cold plunges, increase it also, high impact aerobics, high impact interval training. These all produce greater levels of brain derived neurotrophic factor. Staying away from fats and sugars helps increase growth hormone testosterone production. In a study, a more recent study looking at high impact interval training, they found that testosterone goes up. In the past studies, testosterone didn't really go up. It was because you dehydrated from the activity that made it look like testosterone has gone up. These newer studies, more modern studies, actually show that it does go up, that it does increase. So yes, there's a lot of things you can do without pharmacology, without hormone replacement. But when you have someone who is living on the edge, thinking about ending their life, what we want to do is we want to accelerate fixing them, and then we'll modify their treatment so that it'll be more self-reliant on good lifestyle. Yeah, some of the people need to be on certain of the thyroid deficiencies. We've converted a couple of the inflammatory thyroid conditions using selenium to drop the inflammation so they make better thyroid hormone, T3 being the specific one. So yeah, biological resiliency. That's why I don't use growth hormone straight off and why I don't use testosterone straight off. Because the worst thing that I see happening in these male clinics, these mills that are out there, is the fact that they don't assess them and try to understand why their testosterone is low. It's just a knee jerk. Your testosterone low, take 200 milligrams of testosterone instead of, oh, in your history, you've had head trauma, car accident, this, that, and the other. Let's do a blood test that looks at, LH, FSH, and testosterone and see what the pattern is. And if the pattern is this, let's try to fix it by anti-inflammatory specific, nutraceutical anti-inflammatory, and stimulating your system to click back on. And that's why we use so much of clomiphene citrate and eclomiphene, because this is the way that we've been able to turn the systems back on. If we can turn on a client's system so they don't need injectable testosterone, look at the benefit. They can continue through life without having to stick a needle into their leg, buttocks, arm, or abdomen. They take a pill. We just finished with a 56-year-old Army major out of Fort Hood who 6 months in his program, he's off of 8 medications that were hurting him, not helping him. And at the end of 6 months, he stops our program except for one of the brain rescue products. And he's continuing to make his own testosterone, 56 years of age. He had been in the military, I think, 23 years, long time, and exposed to a lot of action or traumas. So that's what we do first. We try to return their system back to normal functioning. And we'll know in 3 to 6 months whether or not we've succeeded. You have people who are impatient and want it yesterday, so we have to deal with both mindsets.
Well, I really appreciate you clearing that up because everyone is, oh, you got low T, you need that TRT, you need that now. And from listening to you and obviously what you just said, there's other ways to kind of up that testosterone, get your natural production going. And I think that's in the society we live in today. It's, oh, once you take TRT, you're on it for the rest of your life. But I've heard you say, and
No,
I believe you mentioned it,
clomiphene.
clomifid, yeah. That you want it, that is your seatbelt, right? Because if you have a Porsche and you run it into the wall and then you put the seatbelt on, it's
Yeah,
too late. But if you take that with the testosterone, that's going to help your natural production. So can you just
right.
kind of go into that and some of those fallacies as far as being on it for the rest of your life and what to kind of take along with testosterone to buffer it?
Right. And I'm honored that you reiterated my analogy of Clomid. I'll repeat it when we get down in this discussion. But the I'll give you a case example. Had a 42-year-old veteran who came to us who tells me that between the ages of 33 and 35, that he was taking 200 milligrams of testosterone cypionate every Sunday while he was active military. Then he retires from the military. He's going to the VA. The VA is giving him his testosterone. Then all of a sudden, they stop giving him testosterone, 42 years of age. So he comes to us. He tells me the story. I run his labs, and his system is shut down. So I said, you're 42 years of age. And if we give you testosterone again, supply you with your testosterone, you're never going to be able to see if your own system is able to produce its own testosterone. So what we did with Jason was we put him onto Clomid. We addressed the inflammation in his brain, and we did 6 months of this very high use clomiphene citrate protocol. And at the end of 6 months, his testosterone barely registered on our meter, barely registered. His system was burnt out. And he burnt his system out by the way he was using the testosterone. So we would normally take someone who used a short term of testosterone, lower dose, and we would check out the parameters, the biochemical markers, and then put them on Clomid. And based on their history, put them on an anti-inflammatory regimen using our nutraceutical products, and then monitor their testosterone. And the majority of, we've got over 900 guys on Clomid doing phenomenally well. And then we have a subpopulation who were on it, did phenomenally well, and stopped, and they're still doing well. So what we try to do is restart the system. And with the clomiphene citrate, we've had 11 guys who we started in our usual protocol, which is on 50 milligrams every 72 hours at bedtime. And we've had 11 guys that we gave 150 milligram tablet to, and they shot over 1,000 in testosterone production, 1,000 of total. Remember, total is junk except for 2%. Free testosterone is the key. We need to focus on free testosterone, which tells us what is available, bioavailability, whatever. We measure the free testosterone is our focus, because you can have high levels of total testosterone and low levels of free testosterone. And we've had a couple of cases. And 2 endocrinologists in the VA refused to give this patient who had a 853 total testosterone, give them any testosterone. He had all the symptoms of low T, of low testosterone. He was moody, he couldn't think, memory recall was gone, libido was off, agitated, lack of competitiveness, motivation. He didn't feel good. That's what happens with low T. He felt that way. So he ended up going to a outside civilian endocrinologist who basically told him the same thing. When he came to us and we ran his blood, his total testosterone was 853 and his free testosterone was less than 5. And what was happening? He was converting most of his free testosterone to junk. I call it junk, but it's dihydrotestosterone. It's estradiol. It's epitestosterone, which is a form of testosterone that you can't even, that has zero functioning. So in people that have been on testosterone short term, we'll try to convert them into using clomiphene or e-clomiphene. And the rationale is, if I put you on testosterone, you're going to burn out your system. And when you lose your testosterone prescription, or you break the bottle, you're traveling, didn't take enough, you're going to crash and burn within 7 to 10 days. So what did we do? We developed what's called the hybrid protocol, where we start everybody on clomiphene citrate to see how their system responds to it. Clomiphene, and I'm writing an article right now, I posted 3 weeks ago on my new YouTube, 4 weeks ago on my new YouTube channel, Testosterone, the Double-Edged Sword, which is a 3-minute long video, which might be a benefit for people if they want to understand a little bit about this area. But the hybrid protocol is where we start everybody on Clomid, we see how they respond, and those people who respond mediocre, but mediocre, not high enough for their lifestyle demand, we'll supplement them with a little bit of testosterone at the same time. So the analogy you gave was, I had one of our patients came to us and said, you know, doc, you're the only doctor I've ever met or heard about that uses injectable testosterone concurrent with citrate. And that's what I said to him. Think of it this way. You've got a brand new Porsche and you drive that Porsche 60 miles an hour into a wall. Then you put your seatbelt on. So the point being that you want to protect the integrity of the system, the biological integrity of the system, by doing everything possible to protect the mechanism from the hypothalamus to the pituitary to the gonads of producing hormones. So the clomiphene citrate does that. And it's interesting that in some of our population, you put them on clomiphene for a while and you stop it, and they'll respond in one of 3 ways. The higher level that they were having on Clomid, they stay there. Or they drop down to a lower level, but still within normal. And then the ones that go back down to 0. And that tells us that the brain's ability to generate by itself the signal to make luteinizing hormone is damaged. And these are in people with blast IED-related damage, head struck on the head, football players, our MMA guys, our boxers, our jujitsu, professional jujitsus who go to, bouts and so forth. They're the ones that, or slip and falls, assaults, all those things can lead to a more permanent deficiency. So what do they need? They need to be on the Clomid. So the circuitry keeps on working, because if they're on testosterone only, and they run out of testosterone, they will crash and burn. And that's what we're trying to avoid, because it's horrible. The guys tell how horrible it is. Some of the guys, me being spiteful, I'll stop their treatment to let them feel what it feels like to be without testosterone and why it's important to be on the Clomid. They get it. They get it. And it takes, with Clomid, it can take 2 to 3 weeks to taper out. It has about a 14-day half-life. Testosterone cypionate, 36 hours times 7, too. It's about 7 to 10 days, and you feel it. And Anthrate's about 14 days. So,
Dr. Gordon, how come Clomid never comes up at these clinics?
The reason why Clomid comes up is because the preconceived notion that it isn't testosterone injections, which is sexy, it's hot, it's cool. Clomid is a fertility drug. So why would I take a fertility drug? It just so happens, it turns on your ability to make hormones. That's how it works in women. That's why e-Clomid, so it could be used for, for addressing hormonal deficiency. But the literature since before 2010 has had studies, 3-year-long studies, showing the efficacy, the benefits of Clomid. It's a tablet, a lot easier to do than injections of testosterone. And state of California has blocked our blended testosterone that we developed in 2002 from coming into California. So you only have to use testosterone cypionate. Our blended is cypionate and propionate. which gets into the brain and body a lot faster than cypionate by itself. Enanthate, 48-hour half-life, it's too long. People are impatient, so we always have to take that into consideration. So why doesn't Clomid come up more? Because majority of doctors don't know how to use it. That's why in 2014, 15, and 16, we did the 3-year veteran study. Now, as I told you, in the 90s, I started on testosterone, growth hormone, and thyroid. And in 2015, the beginning of the second year of our study, I was looking at the results from the first year. They were so good that after 17 years of using injectable testosterone, I stopped it. Now I use clomiphene citrate because it works so very well. I was on a low dose regimen of testosterone, so my system did not totally turn off. So I use the clomiphene 50 milligrams every 48 hours. The majority of our patient population every 72 hours. Why 48 for me? Because the damage I did to my system by using testosterone injectable for 17 years, even though it was low dose. So clomiphene citrate, one, it's, guys who want to have higher level of testosterone don't walk in and say, hey, I want clomiphene citrate. They say, I want the juice. I want the testosterone. And the doctor is not going to educate them because they need to be educated themselves on the benefits of it. And now that we have e-clomiphene out there, more clinics are starting to follow some of the stuff that we started presenting to them, years ago. 2000, I started with Clomid 2012, 13. And then because of the military, increase in military, and they couldn't get testosterone, we started using Clomid and did that 3-year study. So I just came back from training another group of docs in Malaysia, Southeast Asia, and in Miami, Florida, on the use of clomiphene citrate. It's a great starting point because if it works for a person, you can get it inexpensively. It's oral, convenient, no needles, no class 3 bullshit from the medical community and so forth. A lot of benefits from it. No side effects. Oh, they talk about floaters. They talk about eye-related stuff. Well, the majority of that literature is on women who take 50, 100, 150, 200, 250 milligrams a day for 5 days. We use 50 milligrams every 72 hours, every 3 days. So we don't see the side effects. And I tell people, don't go to the webpage, don't go to the internet and Google clomiphene citrate side effects, because you're going to be reading about a protocol that you're not going on to. And then having ophthalmology, one case of someone who had retinal detachment in a female, high dosing of Clomid because it blocked estradiol that's necessary for the retinas. So there are things, you have to compare apples to apples. They were comparing, porcupines to raccoons.
What about HCG? Does that fall in the same kind of category as Clomid, or is that different?
Yeah, HCG, there's a receptor, luteinizing hormone HCG receptor, which theoretically clomiphene works on. Yeah, HCG works, but it's injectable and it's become very expensive because of the HCG diet. And the FDA got on board in that. And what did they do? This is a prescription medication. They registered it and monitored it like a class 3 drug. And the price went up crazy because you couldn't get it. And then they're blocking compounding HCG. So it means only the pharmaceutical, the proprietary brand, and they've got their prices sky high. So it becomes cost ineffective, where clomiphene is very effective because it's being compounded. And we have a number of facilities around the country that are compounding it for our veterans. And it's costing our veterans less than $100 for 6 months supply.
Is that just for veterans?
There are avenues to get it to our civilian population.
Okay.
Okay. But it works very well. As I said, I'm on it. And it was strange that the only generic pharmaceutical company that was making Clomid disappeared. It just
Shocker.
disappeared. Don't know why. Tried finding out why. Why would you be the only company making Clomid, proprietary, pharmaceutical company, and then shut down the production when you're the only one? There's got to be a reason behind it. Could it be the fact that for those people who have COVID-related hypogonadism due to the inflammation that COVID caused, that the only way to fix it and recover from it is with clomiphene? I don't know. Could be. Another area, yeah, you had a question?
Yeah, not kind of related to what you were on, but you talked about um Clomid and as long as you don't abuse TRT, have you ever come across someone with TBI who comes to you that you can't turn their production of testosterone back on with Clomid?
Yes. And I'll know that in 3 months.
Is that usually like dependent on the severity of the brain injury?
It's a combination. If you go into their history, they'll tell you that they used to use testosterone a lot when they were active military. And and what to back up a little bit, what led us into doing in 2014, 15, 16, the clomiphene, veterans clomiphene study is because in 2013 or 14, the Department of Defense told the Veterans Administration to stop giving the military testosterone because they were trying to say that testosterone was causing them to be too aggressive in the Middle East, in Afghanistan, and in Iraq and so forth. So that was the impetus behind why we needed to look for an alternative. That was really the push behind it. And I had been using clomiphene citrate in small amounts in certain patients that didn't want to inject, that were afraid of needles, who had prostate cancer or whatever. And so we went to alternative and on some of the cases, but it was this edict from the military, from the DOD, that forced us to find an alternative, because most of the active military that we were seeing were getting their testosterone dispensed to them by the VA. And then some of the retired veterans were getting their testosterone from the VA, and then it stopped. Okay. So that's what led down that pathway, which was great because it caused me to stop injecting myself.
And so, doctor, for someone who's listening to this, maybe has a family member that has had a TBI and maybe not military or that along those lines, where do you recommend they start, seeking some of the treatments and things that you're doing, and maybe if they're not in Texas
Yeah,
or,
well, I have licenses in Florida, Texas, and California, and am able to provide diagnostic modalities to everyone with a comprehensive report that they can bring to their treating physician, and hopefully their treating physician will read it and understand that they need to be started on XYZ and be able to move it forward. The protocols that we developed over the past 30 years are ones that sidestep problems caused by using testosterone. Like testosterone, we think, what is it? Single treatment therapy with testosterone is the worst thing in the world. And why that is because my colleagues have forgotten some of the fundamental science in medicine, which is if I put testosterone into your body shuts off the signal for the body to make its own testosterone, called luteinizing hormone. So over a course of time of my supplementing my body with luteinizing hormone, with testosterone, I lose my own body's production of testosterone. Well, there's more to the story. It turns out that luteinizing hormone is the rate-limiting hormone for all our steroid hormones in our brain and in our body. In fact, there's 35 plus or minus hormones in our brain that need luteinizing hormone to convert cholesterol to pregnenolone. pregnenolone to allopregnenolone to progesterone to pregnanediol to cortisol, cortisone, aldosterone, DHEA, DHEAS, estrone, estradiol, estriol, DHT, testosterone. And then all the androstenedione and some of the in-between chemistry that's important to our functioning. Using testosterone shuts off 35 hormones in the brain. And what the classical presentation is, the patient will go to their doc and say, you know, doc, in the beginning of treatment, I felt really good, but I don't feel that good anymore. And what does the doctor do? He says, okay, take more testosterone.
Yep.
And you take more testosterone, you start feeling a little better. And then all of a sudden, you're back down feeling terrible again. It takes 4 to 6 months for this effect of injecting testosterone to start draining the hormone production in the brain. 4 to 6 months. So what happens is between 4 and 6 months, you might start feeling that. There was a period in 2020, I think it was, where we started getting a lot of guys coming in with that scenario. During the beginning of COVID, people were popping a lot of testosterone and nothing to help support it. So what do you need to support? Well, there are 2 main pathways that get nailed by testosterone being given. That's luteinizing hormone regulated. Pregnenolone production, which goes to a whole bunch of very important chemistry of the body and brain. And then DHEA, which goes to making our androstenedione, testosterone, estrone, estradiol, estriol, DHT. So there are 2 key pathways that get shut off. So what we do is we give pregnenolone to fulfill one pathway, and we use DHEA to fulfill another pathway. We usually give 50 to 100 milligrams of pregnenolone based upon their laboratory test, and we give either 15 to 25 milligrams of DHEA for females or 25 to 50 milligrams of DHEA to males based upon their lab results. And the 3 cardinal hormones you need to replace if you're going to do it is the testosterone, whether or not it's injectable testosterone or Clomid. Clomid will do the same thing because you're elevating testosterone, which shuts off luteinizing hormone. The other is DHEA and pregnenolone. So those 3 always together. Testosterone product, making it or replacing it, and DHEA and pregnenolone. That's the base of it. And that's how we've been able to, impact so many people in quality of health without causing a problem with affecting their biological integrity. And the same thing with growth hormone. With growth hormone, you give growth hormone. I mean, right before this program with you, I had a case where a guy had been on injectable growth hormone for many years. And what it did was it shut off his own program, its own production. And if he was on a secretagogue is a product that stimulates your own body to make more of whatever you're targeting. Well, with a secretagogue, for growth hormone secretagogue, we target the pituitary's ability to make and release growth hormone. So what happens is we're not replacing growth hormone, which shuts off your system. We're sending it the signal. We're amplifying the signal that your brain does to make more growth hormone. So in fact, this product was one of my first work for hires back in 2001, hired by a company to develop a product for them, which we did. Owner of the company became a close friend. He handed it back to me. And in 2006, we launched to physicians only a product called secretropin, which is a growth hormone stimulator. We've had it now since 2006 in physician hands. And why it's still being used, because it works. It works on 6 different pathways in the brain, where things like CJC, sermorelin, ipamorelin, MK667, they only work on one pathway in the brain. So that's the reason why a lot of times they fail, is because they're functioning on one pathway. And when you keep on pounding away at one pathway, the body says, hey, enough's enough, shuts itself off. And that's called homologous downregulation, where sermorelin, ipamorelin, and some of the other CJC and similar stuff, GP6, 2, 4, whatever's out there, they create a signal to tell your body or your brain to stop reacting to it. So how does it do that? It stops making receptors. So you need receptors to recognize the hormone. So it shuts down the receptors, mRNA receptors. So that's the reason why we try to keep the biological integrity, try to encourage the body to make its own stuff first, and that's testosterone and growth hormone. And then by modulating inflammation, looking at their medication, we can get increase in thyroid and other hormones as well. That's what makes us unique in how we approach this. If we need injectable testosterone because we fail, put them on injectable testosterone after reading them, having them fill out a paper that says, okay, it'll cause all these things to happen, and you're committed for the rest of your life, but your system's burnt out. So what are your options? The option is testosterone. I don't deny it to anybody, but I at least try to do the right thing for them, even though they don't know it's the right thing. But I spend a lot of time explaining everything to them. That's why our first consult with the laboratory is an hour long, where we go through line by line each one of these items, the 28-point biomarker panel for health, traumatic brain injury, psychiatric conditions, traumatic related issues as well. And we go through it. And then they end up with a 90-page handbook custom designed for them, which goes through everything that we talked about and supportive documents to help them to understand, to register, what it is and why we're doing it. And we spend, every time we have labs, we get together for a consult that we review in detail and educate at the same time. Because a well-educated hormone, I have to think of what it is, but hormone supporter, they need to understand it so they can control it. The worst thing for me is being responsible for these adults to know how to use their products. That's why I spend extra time in teaching them everything so they can be self-knowledgeable. But more so, people go up to our veterans and said, darn, Billy, you're doing so well. What are you doing? And they're able to state it. I mean, if you watch my partner, Andrew Marr, ex-Green Beret, on the Montel Williams, he tells this incredible story, which is the biochemistry of what I just shared with you. And he's able to reiterate it because he's been with me such a long time, not chronic treatment, but we partner and we go and we share this with other military. He and I went to Washington in February to present in Washington. He went with me to Imperial College in London to present at Imperial College. They wanted to know why their top military were flying into Los Angeles to get assessed and treated. My simple answer was maybe they want to get better. And then when we went there, Andrew gave a phenomenal presentation from his standpoint as a traumatized military through blast wave. He was knocked unconscious from a large blast, not a scratch on his body, but 6 months later, he's on 13 medications, full-blown alcoholic and suicidal. Less than 3 months, he's off all his medication, ends up writing the book that becomes the movie Quiet Explosions, founds with his brother Adam, the Warrior Angel Foundation, gets an MBA out of Pepperdine. It's a guy that when I first met him, he wouldn't look you in the eye, couldn't look you in the eye. Now he walks proudly in everything he does. So.
One thing real quick, Jim, before we get into the quiet explosion, real quick, for someone who is just on testosterone with no Clomid or anything, would you recommend the pregnenolone and the DHEA, or would you say
Yes.
start asking questions and maybe?
No. If they've been on testosterone, you need to get back up the brain chemistry of pregnenolone that's based on pregnenolone and based on DHEA. Depending upon their age, if my oldest is 94, okay? 94, Korean War veteran. His dementia's gone, and I started a YouTube channel. So there's a two-part video of Edward Riebach, whose son I work with in Florida, the Gray Team. They help support certain medical access to certain medical procedures for veterans in Florida. And his father, he called me, he says, my father's 93 at the time, and he's got dementia. Is there anything you do to help? So I sent him the phase 2 protocol, stuff that's coming to you guys. Phase 2 protocol, 60, 70 days later, I get an email saying my father's dementia is almost gone. I said, let's get on a Skype. I want to run him through some questionnaires, the MMSE, which are questionnaires for Alzheimer's patients. So we ended up having a 40-minute discussion that was really neat. He's a PhD in young child development, and two of my 3 daughters were giving birth shortly thereafter. So I wanted to know what I can tell him. And we had a great conversation. 90 days further, 180 days in the program, he's on television talking about his exercise program, and he's crystal clear. And I'm listening to his word skills. I'm listening to his word acquisition. I'm listening to how he puts his sentences together. This guy was absolutely phenomenal, 94 years of age. So people could go and see the benefit of what happens when you address the neuroinflammation that creates things like Alzheimer's, Parkinson's, ALS, MS. And we've had cases of these that we've reversed. Some of them 100%, usually around 70 to 80% is the average. My daughter has an ALS patient who, according to his doctor, has gotten better. It's an inflammatory process. And you go through his history. He played football, professional football. He was a fireman after his football years. Okay? That's what he was a setup to traumas, smoke inhalation, toxic fumes. Not always do they put their mask on in a timely manner. They get exposed to fumes. And now we've got, a lot of our veterans who have burn pit related issues from all this crap figuratively and literally that they burnt in the pits. And it's toxins, whether or not it's hydrocarbons or plastic vapor, whatever, messes with the chemistry, induces inflammation, and then lays some forever chemistry in their brain. So anyway, you wanted to go on to quiet explosions or?
Well, wanted to go on to quiet explosions. Also, like Rich said at the beginning of this podcast, Live Life Aggressively podcast, and Joe talking about you for all those years about being the testosterone guy, being the guy to look into his information when it comes to testosterone. So that is kind of like the new thing going on today. Hey, we all have low testosterone. How do we fix it? So last year around this time, I was working, putting a podcast together for another gentleman, and we were trying to contact testosterone experts. And you were the first person I thought of. So I went and I started listening to some of your episodes with Joe. And you were on there with Andrew Marr, and you brought him up before. And you were talking about TBI. Now, I don't know if that was something I just didn't pick up on back in the day when I first was introduced to your work, but it's hit home for us personally, with a family member.
Right.
And I feel like your information for us is like that light bulb, right? But it's hard to kind of talk to people about this, especially being Rich. We tell our family members about this. Oh, those are the 2 crazy kids with the podcast. No one wants to listen to us. But if we have you on, we talk to people like yourself who are able to kind of give this information out to people.
Right.
How do you, and I'm sure you have dealt with people wanting to bring their family members to you or get it through to their family and they can't. How do you suggest people kind of go around that to get this information out there if their doctor's not giving it to them? They hear this podcast and they're like, wow, this might be the answer.
Right. Well, I have a lot of educational papers that I've written, articles that are on my website. I do not have published yet or released yet the clomiphene study or the clomiphene, understanding clomiphene's use. But if I picked up on some of what you said, The issue with testosterone, and I'll come back to how they can get in touch with me if they want to. The issue with all our hormones is that we think of testosterone, estrogen, progesterone as sex hormones or reproductive hormones. But it turns out that every one of our hormones has a multitude of benefits. We call it pleiotropic, meaning it has many effects on the body. Testosterone, for instance, has an incredible ability to drop inflammation throughout the body. That's why people with orthopedic injuries with low testosterone have greater orthopedic problems. And when they get on testosterone replacement, some of their orthopedic problems and inflammation resolves. It turns out that testosterone directly drops four key inflammatory immune system cytokines: interleukin 1, 1 beta, tumor necrosis factor alpha, and interleukin 6, as well as it turns on one of the strongest anti-inflammatory products called interleukin 10. And by dropping inflammation, you recover. That's why testosterone is so important. And in talking about delivery systems of testosterone, injectable is by far the best over topical. I haven't used topical 9 years, because topical application gets converted to DHT. DHT can't get into the brain. So you need to give them a form of testosterone that can get into the blood and stay as free testosterone. And that's injectable. Or using Clomid to turn on free testosterone production by the testes. So how people can get information is at the website, tbihelpnow.org. If they want to get access to our program, they go to TBI Med Legal, TBI Med, M-E-D, legal.com. And there's a request for information page where we send out a information packet and an application enrollment form if they want to do that. So that's the simplest way that we do it. And I personally am only working with the military because there's a lot going on right now. And my daughter, for the past 9 years, has been taking over our civilian population, and she's doing really well. When you have my daughter Allison, when you have a physician whose son is being seen by her, calls me up and says, "Look, your daughter's doing fantastic. This gal is hypercritical," which I appreciate, and saying how well her son's doing and how well the daughter is conveying it. You know, some of my patients have gotten a little bit upset that were my civilians that I passed over to my daughter because I'm on half time now in my workload. So I can't take care of everything I used to in the past because my time is allocated on this project to stop suicides in our military, in our veterans. 44 a day, not 16.7 or 22 that they pull out of the rabbit's hat or out of the hat instead of the rabbit. It's 44 a day, as was told to me by people on the inside. Okay. So I hope that answers, the question that you were looking for, or the answers you were looking for.
Absolutely. Yes.
Okay, good.
You have done nothing but answer more than what we've asked tonight, so we greatly appreciate that. You bring up that you only work with military now, and on your email, your signature is you never served in the military, but you serve those who do. What is the call on? Is it because that suicide rate is so high, you feel like you need some intervention there? What is that call on? What kind of draws you towards that service?
Yeah, what happened was from 95 until 2007-ish, I spent a lot of time with the NFL with players. And I got to a point where they irritated me to the point where they were making millions of dollars a year and would never help me with my other projects that I was moving into: law enforcement, um, taking care of law enforcement, fire department, military. So I said, I'm not going to spend any more time with these guys who wanted everything done for free anyway. So I turned my attention, and in 2009 made the commitment to address the issue of military suicides. And that was in 2009. What really brought it home was when I met Andrew Marr, ex-Green Beret, EOD, explosive ordnance and demolition, and saw him. And he was devastated with 13 medications after, in his fourth tour of duty, gets blown up. And then gets onto a program and writes the book, the movie's made, gets his MBA, everything I shared with you earlier. And he really brought closer to the heart the need, his passion for doing the same thing I was doing. So you had two people on the same page who, as we got closer together, we were critical mass. And that critical mass has been picked up by people understanding our commitment. And it turns out, to some degree, my father was Army. And my father died at a young age from cancer of the bone, which turns out to be one of the cancers from the bases. Port Lejeune has multiple myeloma. That's what he died from. And so I was in computer technology and bioresearch at Cedars-Sinai, UCLA, and was in school working towards a PhD in immunology. He gets bone cancer and dies. The next year, I'm in medical school. I didn't plan on medical school, ended up in medical school. And, just did the best I possibly can. Ended up going to Rush Presbyterian St. Luke's, Fifth Pathway, graduating medical school, then did my residency in Chicago, and then came back to California to start working in family medicine and workman's compensation, where everybody was being injured. And then, for whatever reason, because of the NFL kind of stuff, looked at the military. So I've never served. Frequently get a veteran who says to me, "Why are you doing this?" Even our VA doctors, who are military most of the time or half the time, don't have the compassion, passion that you have. And you've done deep dives. You've discovered stuff that you've shared with your medical community, those that will listen to it, obviously, that is paradigm shifting. It's killer of old technology. I said, why else be in medicine if you can't advance things that can make a difference? So that's why I'm doing what I'm doing. And in the fact that we're self-funded, everything that I develop, my traveling, getting paid for lecturing here and there, that all goes, they don't give it to me. They send it into our veterans account. We have got over 2,000 veterans that we've helped through our program. I won't do the math for you, but it's up there. And it's the greatest thing to receive in an email of one of our suicidal veterans saying, "I don't know what I was thinking. I'm great. I'm back with my family. I'm now the father to my children. I'm the brother to my family or my sisters and brothers. I'm the son to my parents, and so forth. I'm back working." We've got guys that have gone back to school, gotten their physician assistant license, one in North Carolina, another one in Flagstaff, Arizona. They went through Loma Linda, or they went through University of Charlotte, whatever the name of the school is there. And, guys are back into society. They're back stable. And that's really the goal. Andrew and I, our focus is on helping them to return. They might have left the war zone and come home, but they left part of them in the war zone. And our job, our goal has been to reunite them, their brain and their body together. And the way is, in doing the 28-point biomarker panel, we see what's wrong, and then we apply that in treatment to fix it. And since our products, Brain Rescue 1 and 3 and Brain Care 2, have come onto the market in the past 3 years ago, about 2021. Thanks to Joe Rogan, we are seeing accelerated improvement. Where it used to take a year or 2 years for people to improve, they're getting better in 90 days, 6 months, rapidly. And we did that study that we put together. It's on the website. It's a comparison between TBI and PTSD, but in the core of the document, it shows in a year greater than 70% recovery. That's key. Okay, that is key. And the recovery, just to be absolutely transparent, recovery for us is 50 to 100% better in that 12-month period of time. 50%. 50 is our cutoff. You have to be at least 50% better. And within 12 months, if they're 50% better, by 18 months, they're even further down the road. And we monitor them every single month. They send in a paper. I respond to every single one. I've got 36 more to do today. Okay. But to see their response, to see that, their wives are calling, sending emails, that their husbands are back, they're no longer emotionally unstable, volatile. They're now in control of their emotions. They're able to cognitively function. We had one guy, Chris, in Texas, who walked out of his University of South Texas MBA program for a master's in business administration. He walked out. 6 months later, he's back in BJJ. He reapplied for his position he walked out of, and he graduates and ends. I mean, in the movie, there's the gal, Nicholas, who graduates from her MBA. She had been horribly raped in Annapolis, military rape, and was on multitude of medications. 7 months later, off her medication, back in life, gets married, 2 kids. It's in Texas also. I mean, when you get these feedback from these people that have, were devastated from whatever their situation is, how phenomenal that is. That is what drives me, knowing that we're able to return people back to full quality of life or a semblance that's higher than what they had before. That is the goal. Altruistic, silly, corny sounding, but that's the fact. And as I told you earlier, I'm a New Yorker, so if you don't believe it, fuck you, okay? Just go and talk to any of our folks, okay? And I call every single one of our veterans. I personally call every single one of our veterans that requests to become a patient, a client. And they're surprised that I do that. They're intimidated for some reason, but that's my job. That's my passion, is to break those stereotypes. That's why all my patients call me Mark. I know I'm a doctor. I know I went through medical school. I know I put in the effort for 13 and a half years, but I didn't do it for someone to call me doc, okay? I did it to get the knowledge so that I can make some degree of difference in what we're doing. And unfortunately, as you know, the species that I come out of, it's few and far between. That's the unfortunate nature of it. What's happening in medicine, it just sucks. And I get it not only from my patients, I get it from my colleagues who are similar to me in this organization I belong to, AMMG, Age Management Medical Group, and just came back from Florida. Great group of guys and gals, male and female docs and PAs and NPs and NDs, and just great people who know that our calling is to treat the person, not to treat numbers and not to treat diseases per se, and to dig deeper to find the root cause. That's the problem with, the traditional approach for TBI or psychiatric illnesses, is that the approach is take these pills, as opposed to, hold on, let's go and look and see why you developed this. There's a biochemical cause for it, and that's what we've proven. We have 7 psychiatrists that are working with us. One of them, Dr. DeMaio in Punta Gorda, Florida, phenomenal. Every week she sends me a case. She's was trained traditional psychiatry, and she got depressed, came to us, got trained, got certified, and started using the software, the analyzer, the AI software package. She's now picking up things that there is no way she would have picked it up in the past, according to her. And she puts everybody through the 28-point biomarker panel. And based on that, she treats, and she sees paranoid schizophrenia disappearing, depression disappearing, anxiety disappearing, all these psychiatric problems disappearing. And then we've got Jason Kiefer in the Hawaiian Islands. He's got 5 clinics that he works with in the Hawaiian Islands. He's applied, got trained, got certified, and is applying our technology in Hawaii. He's getting incredible responses that are higher than just giving medicine. It's by fixing the cause and not treating the symptoms. And that's the premise of what we do. Biological integrity is you find the cause, you treat the cause, you don't treat the symptoms. That's it.
So do you get a lot of resistance and stuff, pushback from the VA and the doctors there?
There are rays of hope because we've had referrals from some of the docs in the VA to us. We're seeing more referral by my primary doc. We're seeing more referrals from shows like yours. We're seeing, Mike Maller is great. And I wanted to interject earlier. I have on my store, the Millennium Health Store, I have his product, the testosterone booster. We did studies on it. I mean, he doesn't talk about it very much that, we've actually done studies on his estrogen blocker and also his testosterone. I go through a lot of the testosterone booster product because that keeps the biological integrity going. Okay. It's a great product that works very well. And I've known Mike for more than 10 years. I've been on his shows in the past. And so that's how we get some of our referrals. Yeah, Rogan's been very good. Because of Rogan, we were able to carry more of the expense for our veterans because our sales of products have increased such that we can carry more. My goal is to be able to pay 100% of a veteran's program for a year. And then after that, if he needs to continue, he can pick it up. But the year will be, an average of about, any place between $7,000 to $9,000 is the average. That's about $8,500 is the average for a year. Everything, about $8,500 for the first year. The second year, it goes in half because you don't need as much laboratory and you don't need as much, our time, because by a year, people are, 50 to 100% better in 70%. And the ones who are less than that, the 30% or the 23% who are not moving ahead, their gut, which I want to talk about if I can. Some of the, what we found is a number of our patients, both civilian and military, hit a wall. They couldn't get past 60%. They couldn't get past 40%. They couldn't get past 80%. And what we found is the gut is generating these inflammatory chemicals called cytokines that go right into the brain, and they create the problems of moodiness, agitation, irritability, foggy thoughts. And the analogy is you get a cold. Are you smarter or less smart when you get a cold? Most people say less smart. And that's because one of the inflammatory cytokines called interleukin-6 goes up. And that cuts down on communication by inflammation. So the inflammation disrupts the chemistry that's responsible for communication. So when you have an ulcer, dysbiosis, malabsorption, Crohn's disease, whatever, inflammation from the gut goes right into the brain and creates a worsening of your condition. In people who have a condition called Crohn's disease, it's a inflammatory bowel disease of the gut. What is associated with them in 60 to 90% of the cases? Depression. Because the inflammatory cytokines go right into the brain and turn on the inflammation in the brain, and you get depression. So what did they find? When they give people with Crohn's disease, they give them a blocker of interleukin-6 or tumor necrosis factor alpha, the two key pro-inflammatory chemicals produced by our immune system. Not only does their condition, medical condition, improve, their depression disappears. Psoriatic arthritis, another major one. You look at psoriatic arthritis and depression, the association. Depression disappears when they get treated. It's because it blocks the inflammatory chemistry. So we look very closely at the gut. My daughter specialized in her undergraduate and medical school in gut brain. And after graduating, she focused a lot on gut and uses a test which gives you a lot of information on bacteria, parasites, flukes, the overgrowth of helpful bacteria. If it overgrows, it creates more problems. Okay. So she looks at this and then treats them. And initially they get worse because you're killing all this stuff off, and then they get better, or else they just get better. And it makes that blockage that we have and they hit a wall, it allows them to further improve. What's been holding them back has been the inflammation in their gut. So hope that answered.
Well, they say your gut is your second brain, right?
Oh, yeah. And also the gut turns on leptin and ghrelin, which are growth factors. So if the gut's problematic, you can't generate the triggers for growth hormone, ghrelin, and leptin, so your appetite goes off. You lose growth hormone function. Neat. Also, gut can absorb amino acids, which turns on growth hormone, as I said earlier, the lysine and arginine and so forth and so on. So all the benefits. Your gut is extremely important. And we miss it. I mean, I got to be honest. We missed it. I missed it for years until my daughter came into our practice about almost 10 years ago.
What's that like,
Yeah, I
working
was
with
just
your
gonna.
daughter and her being it seems like a superhero?
Well, she'll probably get pissed off if she ever sees this. The first day she came into my office, I fired her because she came in as my daughter. And I said, the minute you cross that threshold into my office, you're now Dr. Allison Gordon with a responsibility to perform at this level. So after that first day, and we talked for 3 hours about it, she ended up coming back, and I rehired her, so to speak. She's independent, and she's just doing a great job. You know, because she covers an area I don't cover. I don't cover the gut. She does. You know, I refer them to her. You know, if it's, I ask, so what's going on with the gut? And now we have a paper that we send out to our patients that say, if you've got a gut problem, we need to go after that because that might be something that delays you getting better. So, but Allison, good. She got married last year in Positano, Italy, to an American, nice kid. And it was a phenomenal wedding. I'll send you pictures afterwards. And then I take her with me when we go to the meetings with Age Management Medical Group. So just before we left, she tells me that she's expecting. So now I have three daughters. Two of
Congratulations.
them gave birth last August, 2 weeks apart. A little Sophia and Theo, and then she's now going to have her first child in November. So it's making me older, you know, rapidly. I mean, before having grandkids, I was just Mark. Now I'm Grandpa Mark, you know. It
Pretty
just
cool,
aged me.
grandpa.
Yeah,
Yeah.
cool grandpa. Yeah, I turned 71 January the 20th. And most people lie to me and say, you look like you're in your 50s. But the one that I accept is your brain is functioning like a 30-year-old. And that's because of all this stuff that I do to help with the brain. And I've been doing it for 30 years, 95 to now, almost 30 years. And I was on the phone with an 82-year-old, one of my closest buddies, who's ex-Marine, Air Force, ex-Air Force, test pilot in the Air Force. And He's doing very well. When he stopped his program, he stopped doing well. When he got up back onto the program and onto one of these peptides, phenomenal improvement, night and day. Communication, much better, more motivated, everything. Really, really cool. So,
Is that another Long Island guy?
no, he's from Ohio gozaimasu. He's from
Okay.
Ohio. Yeah.
Okay.
Yeah. What was it? White White Patterson is where he used to,
Oh,
White Patterson, which was the
that's
Air
where
Force
the
base.
Roswell stuff is.
No, this is in Ohio. Roswell's in New Mexico.
But they
So,
brought the Roswell stuff
oh, they
to,
brought it up there?
yeah, it's in Ohio.
I didn't know that.
Yeah.
Thanks for letting me know. Now I've got to find out. But
Get your
he was,
tinfoil hat.
uh, what's that?
I said, get your tinfoil hat on.
Well, someone just gifted me with a hoodie that's silver, that
Yeah.
has silver
Yep. We've got
silver
those.
in it. You've got them? Yeah.
Yeah.
The
So
bees.
yeah, it was a birthday gift that I'm still waiting for. But anyway, so I've got, the meters for radiation. I've got the meter to tell me how much radiation from EMF. Unbelievable.
It's
My
crazy.
router, which is now on the floor, puts out 30,000. My ambient here is 800, but in front of that, 30,000.
Yeah.
In front of the microwave, 360,000.
It's everywhere.
Not good. It's everywhere, right? So
Jimmy and I threw our microwave out a couple years ago.
good for you. Good for you. I have a one of those caution lines on the floor of the house. So if you turn on the microwave, you got to go outside that line.
Yeah.
Please stand back. Please have the computer. Please stand back. You are in danger zone. Will, be careful. Lost in space.
Yeah.
You got to
They
get
have
one of those dentist vests.
Say again?
You got to get one of those dentist blankets that they put on you when they do your
Oh, yeah, yeah,
x-rays.
yeah. My wife's a dentist. So yeah, she puts that heavy leaded thing on you, to protect you. But they're using digital radiologic equipment, which uses far less radiation
Yeah.
than the old style, beam. So on digital, much more sensitive to the rays.
Yeah.
I forgot. I don't remember what percent reduction, but it's significant. So that works cool. So there's an article that I posted that it's an interesting topic, which is on endocrine disrupting compounds and the cause for gender dysphoria. I mean, look around. Gender dysphoria, either it's a Me Too kind of mindset that they want to be included, whether or not they have it or not, but they want to participate. But I think it's reality. It's a true issue. And when I did my study before writing the article, it turns out that in the brain of a developing fetus at 6 to 8 weeks, 5 to 7 weeks, that there's a pulse of hormone that starts the process of determining your mind gender, your mental gender, regardless of what your genetic code is, XY or XX. And then there's at birth, between 1 and 3 months, there's a conformational second pulse of the hormone. So what's happening is these endocrine disrupting chemicals block that early in gestation fetal hormone release and block the postpartum. So what happens is the brain does not have set in stone your gender identity. And that's what causes the gender dysphoria. And it's hormone. And the scariest part is that it's what they call transgenerational, meaning that a mother can pass it directly to a child. Mother can, through her blood, pass it directly to a child. Those forever chemicals. Forever chemicals. So that's the reason why I believe we're seeing an increase in the gender dysphoria. And it's a biochemical, hormonal, precipitated by our toxic environment. And that's why we need to be clear on what we're putting into our mouth, what our environment is. Is there Roundup, the glyphosates nearby? Is there B, C, P, A, B, X, Y, Z, whatever letter you want to say out there that's putting us at risk for endocrine disruption or not? You know, that's the things that we need to take into consideration. And I guess another area is since 2015, have been participating in the realm of psychedelics for
Let's go.
treating PTSD, TBI related symptoms, depression, treatment resistant depression. But in treatment resistant depression, there are 5 hormones that predispose you to that. Growth hormone, major study came out in 2017 by University of Birmingham, I think it was Birmingham, UK, where they looked at people who had what's called treatment-resistant depression. These are people who are put on medication and they continue with depression. The medication's not working, so they put them on 2 meds or 3 meds or change to another group and 2, 3 meds. And what they found is in 61% of the people with treatment-resistant depression, they've got a growth hormone deficiency. And within 1 to 2 months of replenishing the growth hormone, their depression disappears or reduces to background, very little. And they ended up with 4 benefits: brighter minds, sleep better, better interpersonal skills, and less emotionally volatile. Okay, so these are some of the important factors with with growth hormone. The others are vitamin D, DHEAS. Estradiol also is very important. We know estradiol's relationship with schizophrenia. Okay, so the psilocybin and the ayahuasca and the ibogaine, the 2 studies that have, where is it, Harvard and Davis or Stanford, relative to MDMA, helps with addiction, helps with depression. Unfortunately, there aren't very many centers in the United States. Oregon, I think Washington State, New Mexico, Texas at Baylor University, and there are organizations, Heroic Heart, with Jeffrey Gould, Dr. Martine Polanco. These are leaders in getting, and Adam Marr, Andrew's brother. Adam Marr is a spokesperson for this conglomerate of organizations to help states to write policies to allow for at least research in psychedelics. Let's see, in Colorado, I believe it's legal. Okay, Colorado's legal. Also, I think in Oregon. And then we have a lot of facilities outside the United States. I work with one that was in Jamaica. It's now moved over to Richard Branson's island in the British Virgin Islands. And, that is where they treat veterans and NFL players with either single or multiple treatments of psilocybin or whatever's on their menu that time. And the response has been really good on treating addiction, cigarette smoking, alcoholism, depression, anxiety, and it's going to be interesting to see what more. And in a paper I was reading yesterday, that it's the effect of the psychedelic is about 100 times greater than any of our antidepressant medications. So the antidepressant medications are trying to fix or stimulate the right receptors in the brain, but because of the fact that they're synthetic, they're not getting to the places they need to be. And the plant-based therapies with the psychedelics is getting in and creating great responses. So they're looking at either major dosing or micro dosing. So major dosing, there was a case, I think it was in Washington State, a gal with obsessive compulsive or manic depression. I think it was manic depression. She overdosed on psilocybin, was hospitalized because of the overdose. And when she got through the overdose, her condition disappeared, was gone. Her obsessive compulsive, no, it was manic depression, was gone, was totally gone. So that is a high dose. So I think what someone's going to look at is these higher doses, single treatments, as opposed to lower doses, multiple treatments. And then microdosing is just placating the symptoms. It's not fixing it. It's just, putting a Band-Aid on, ripping it off, putting a new Band-Aid on, ripping it off. So the world of psychedelics or psychedelic assisted therapy is really heating up. Everybody's vying for a position. Universities, Stanford, David, Harvard, Yale, all the institutes are looking for it. And fortunately, one good bill that was signed by someone in the White House was the bill for veterans to have research to be done in the Veterans Administration or Administration for psychedelics. That's great. Andrew was participant with Morgan Luttrell and Rick Perry, the last governor of Texas, for HB 1804 or 02, which got funded by the state to fund the first psilocybin research program in Baylor Medical Center, which is cool. And we've got a bill, Andrew and I have a bill that's being presented to the Congress of Texas for funding HB 4185, for funding for a project to treat 250 Texans with our protocol and doing a parallel study. What is it called? A control study on our program. I mean, we've got, between my daughter and I, we've got almost 9,300 people that have on program, gone through the program, recovered from the program, with great outcome. And that's how come we got picked up or called by Ukraine and now in Australia, with the army in Australia because of that. And then we went to the UK, United Kingdom, because of their suicide rates going up. So, but our system is an answer, not necessarily the answer. And it's for both civilians and veterans who have psychiatric, neuropsychiatric conditions that are the result of trauma or no trauma that you can identify. That's what we'll identify. What did it? A lot of times it's missed during the first 5 years of age. Okay? During the first 5 years of age, it's missed.
Well,
Okay.
I'm glad you brought up MAPS and the work with psychedelics, because that was a question that I had and you thoroughly answered that. So I appreciate that. Rich, before we get into the final four, do you have anything else for Dr. Gordon?
I mean, I could sit here and talk all night and listen to Dr. Gordon talk, but we want to be respectful of his time. He's got some things he's got to answer, 36 more of them to go
36
tonight. So
papers.
let's get him with the final
Yeah.
four and get him out of here.
All right.
Yeah.
So
Yeah.
first,
I said, go ahead.
so we have final four. It's 4 questions we ask all our guests at the end of every podcast.
Sure.
First one I got for you. Are you a coffee drinker?
I love coffee. I collect it.
How do you brew your coffee and how do you take it?
I brew it on a Swiss system that grinds it and pushes out either I have a regular cup of coffee in the morning and I have an espresso, double espresso at about 3 o'clock. So before I came on, I had my double espresso in my Brazilian cup. Okay. So I collect from Vietnam, Cambodia, where else? South America, Brazil. They bring me coffee all over. And what do? I have it black. I'm very prejudiced. I have it black. and I'll use either a quarter teaspoon of sugar if it's a little bit bitter, or else I'll straight up.
Excellent.
Okay. Number two,
Dr. Gordon, do you have any practices or rituals that you do on a regular basis to show up as the strongest version of Mark Gordon?
um, I try to live the life I offer to other people. So I exercise, bike ride. I spend 2 hours 3 times a week on my hillside cleaning it and digging holes to put fruit trees in. Um, I remove a lot of the junk out of my nutrition. My daughter Allison came to the house and pulled everything out. No glutens. I said, but I have no problems with glutens. So she brings me some gluten stuff. She makes sure all my vegetables have been washed and cleaned and are healthy. Um, you know, I have a cigar, a small cigar, maybe once a month or once every 2 months. I drink scotch to make sure my liver is working well and detoxing. You know that N-acetylcysteine and glutathione upregulate an enzyme in the liver called alcohol dehydrogenase. So it's almost impossible for me to get drunk. And I'll sit down with my 3 son-in-laws, and we just went through 2 bottles of really good scotch. Now, how they felt is one thing, you know, you know.
It couldn't hang, huh?
Yeah, we do. And we're tomorrow. Today's Tuesday. So tomorrow we're gonna all get together. So
Nice.
Awesome.
have it together. So I got to figure out what bottle of scotch to hide. Because I've got, I don't buy scotch anymore. People know I enjoy a good scotch. And I used to drink, have 2 ounces, 4 ounces every night. And about 2 years ago, I realized how I didn't feel as well waking up in the morning after having scotch. So I removed it from my diet. I don't have wine. My wife likes to have a nice red Italian wine at night. So I go to Trader Joe's and buy a cheap one and put it into an expensive bottle. And I'm just kidding. It just sounds funny.
Had us.
Yeah, right. So, and she'll have a glass of wine maybe 3, 4 times a week. If I have a hamburger, I'll have an 805 beer. If I have Mexican food, I'll have a 805 beer. So it's light.
All right.
So I try to, stay away from alcohol. Don't smoke weed. I've got a pound of it sitting in the backyard, but I don't smoke it. What else? Drink good purified water. Try to drink a lot of it. I'll have some H2. I put some hydrogen into bottled water and it fizzes, and I drink my hydrogen. We did a study for the company with our military, and the results, I wasn't anticipating the results. They were good. So hydrogen water is good. I'm now looking at a hydrogen water bottle, and one was referred to me that is made from glass and not the plastic. They found the plastic ones leach out chlorine. So you got to look out for that. So
Interesting.
number 3.
What are you listening to right now? Music, podcasts, audiobooks? Are you reading anything?
My problem is I read between 10, 20 medical articles per week. I play guitar. I've got my studio Les Paul behind me. So I'm just working on Red House by Jimi Hendrix, the lead on Red House. And I write music, and I stopped reading pornography. That was human sexuality books, and I call it pornography. Reading, if I read something like I'm on vacation, I'll read a spy novel. Okay, Clavel is the guy that I read, Clavel. He's got a lot of books. I like the twists and turns, and I guess it. That's the problem.
Is
You
that like
know,
a more sophisticated Tom Clancy?
I've gone through Tom Clancy. My daughter just got me. I try not to watch television too much, but I start work like this morning. I started work, got up at 7 o'clock, started work at 7:30. Still, 3:30, put a couple hours aside for this, and then I'll continue working until 9 o'clock on some of the 36 papers, 36 responses. And then at 9 o'clock to 10 o'clock, I'll watch a program. And what I'm watching right now is Fallout.
Okay.
It's on Prime. It's called Fallout. It's from a game, a computer game. I don't play computer games. If anything, I'll sit in front of my chess and play a couple of chess games with out of the book. You know, checkmate in 5 moves and set it up. You know, like the back of the New York Times, Sunday Times. They used to have the chess games, or the LA Times on Sunday. So I played chess.
Okay.
That's it.
Awesome.
Lastly,
Last one we got for you, Dr. Gordon. Do you have, I kind of covered it, but maybe there's some other things. Do you have a guilty pleasure or guilty pleasures?
yes, when I'm in Thailand, I like going for massages without happy endings.
No lady boys.
Well, I've taken each one of my daughters to Thailand with me so they can see what I see. I was medical liaison and medical director for the largest hospital network in Thailand, called Bumrungrad Hospital, for a division called Vital Life. So I was on contract there for 3 years. So started taking them with me, and massage and eating. I like good food, a nice tomahawk,
Mm,
nice bone and ribeye. Wagyu, a little bit too rich for me,
yeah.
especially when you get up to the nine, where it looks like cheese spread, with all the fat in it.
Yeah.
So the lower ones are really good. Um, Food, I came from a restaurant family, so I cook. I make limoncello from our lemons, and I make pomegranate wine, pomegranate liqueur from our pomegranate tree. And we're gonna have a ton of limoncello. Where are you guys located?
South Carolina and Florida.
South Carolina, Florida. Yeah, it's easy to ship it there. But the key in making the limoncello, it's got to be frozen. Okay, it's frozen, and if the alcohol is right, it doesn't actually freeze. It's like a slushy,
Okay.
and you pour an ounce of that into the glass. And when you're drinking it, you don't taste any alcohol. But if you should take two of them, you're gone.
Oh yeah.
Yeah.
I had a evening in Venice with some Kiwis,
Okay.
some people from New Zealand,
New
and I
Zealand. Yeah.
happened to pick up a bottle of limoncello on the trip, and we were all having cheese and all this stuff, and I was like, let me go get this, and we finished the whole bottle, and man, the next morning it was a
Oh,
train wreck.
yeah. That's because of the ultra high sugar in it.
Yeah.
They use the standard uh, lemons in it. I use Meyer lemons. I grow Meyer lemons because they're sweeter, not as tart. So you need a third the sugar. So you get the tartness, but you don't get that sugar because you got it on the Eureka. Eureka lemons are the traditional ones they use, or the Italian version of the Eureka. But yeah, Venezia, Piazza San Marco. Sì, le parli italiano non tutto bene. But yeah,
A modern day Renaissance man.
well, you have to be.
Fascinating.
I have to keep myself entertained, you know?
It's
Well,
That's the
amazing you
problem.
have the time to keep yourself entertained with how busy you are.
Well, I take 15 minutes off every hour.
Oh, okay.
Otherwise, what happens is my back doesn't feel good, and
Mhm.
I get bored. So I take 15 minutes off, go lift some weights, then come back and sit down and have a nice, pleasant chat with you two for whatever length of time.
Well, it's flown by and it has been amazing, and it's been an honor and a pleasure, and so much information. We can't wait to share it with our guests and our friends and family, and spread the word of all the good work that you're doing. It's very impactful, and we didn't even get to touch on the movie, but we will put that in the show notes as well, because that was very impactful, and I really enjoyed watching it.
Right. And I think I'll send you a link. The link is from the producer, who it's a free link. I don't know how much longer the link's going to be. It's on iTube or something, I don't know how long it's going to be available, but if you have people who are viewing this, the movie Quiet Explosion goes through the clients, a group of clients that we have. There are 10 in the movie, but I think 6 of them are our clients from our patients from the practice, and they tell their story. And they're very, very stories that draw you in, very emotional on how bad they were and how just by looking at their chemistry, correcting their inflammation, returning their hormones to normal, they improve. So it's them telling the story. It's not about me. It's about them and their journey. And, my goal is to get this information out there as best I can, as best we can now, so that other people know that there's an option, an alternative to the traditional take these pills and just deal with it. Fix the problem. Don't mask the cause. Don't mask the symptoms. Fix the cause.
Well, you got that Joe Rogan bump, and now you're gonna get the Airy Bros bump. So
Okay. All right, guys. And then when you get the products, try them out. I'll tell you how to
absolutely,
use them, and then give me feedback. Okay.
definitely. Thank
All
you,
right.
Thank you
sir.
very much. Thank you
Thank
Appreciate
for
you
your
you.
both very
time.
much. It's been a pleasure. Thank you.
Have a great